Europe, was is Europe that probably has done much better in terms of this, in the first week of September. So it means, honorable members, if I continue pushing and we do what we can do, first week of September, we might be ready to do the study tour, because the study tour is actually to allow us to say, we are back with that knowledge. Department, come now. We're armed with good knowledge and observations. Listen to you. These are the things that we are proposing and listening and getting all that. Prior to then, the first or second week, we do what Honorable Clark has not referred to, clause by clause. If we do clause by clause, second week of September, we may just be completing that process by end of September. So in between, Ma'am Shongo, you are consulting with your party, you are actually getting money to say, what do I say on this part that says about this on the bill. So that's where you get your mandate and continue. So those are sort of a rough estimate, Honorable Mutubase, to say by the timeline should be here. First week of September, we have completed this process that we are engaged in. Therefore, we visit a particular country or countries, process, and then we come back and then do clause by clause, and hopefully finish that towards the end of September and ready to hand over this bill to the National Assembly, process it, and then hand over to NCOP. So those are rough timelines one can project, and we really need to please push ourselves to maybe meet those timelines, because if this bill, Honorable Mutubase, you are correct, is not processed by the National Assembly by September, we may have to get into another mode of parliamentary work by October. And we may not then get it back to us until the new year, which is something that is not desirable from our side. Let me then stop there for now, honorable members, and say, unless there are other comments, but all of colleagues were agreeable. I just needed to respond and add on to some of the clarity-seeking comments and questions that members have raised. Thank you very much. Let me check if there's any other outstanding that I have left out or another member wants to say something about it. Thank you. Okay, there's a hand that did not come up there first. Honorable Mchatu. Hold on, Honorable Mchatu. Hold on, Honorable Mchatu. Okay, and Mutubase, your mic is want to speak again.
Yes, Chair. I wanted to check. I just wanted to check. Is it my network? Because you come out, I think, at time hugging. I don't know whether it's my network or it's the experience of other members. I miss some points as we talk.
Honorable members, was I cutting here and there?
Yes, Chair.
Yes, Chair, you did.
Chair, I think it's network, because I'm having the same problem today.
Chair, I heard you at the end better, but at the beginning.
Towards the beginning. Oh, God. Honorable Mjadu, come through.
Thank you, Chair. I just want, I think it's a clarity. I just want to find out, Chair, what was wrong with this arrangement for the bill? And I don't agree with some of the members that we can't change this arrangement. If it was done by the Parliament, as members of Parliament, I think we're having a right to amend if there is an error in this arrangement. But Chair, maybe you can just give us a briefing. What was wrong with this arrangement? Is there anything need to be amended or changed to this bill arrangement? if there's any. I just want to know from you, Chair, who did this arrangement? If it is Parliament, we are members of Parliament. We can change rules. We can correct me if I'm wrong, Honorable Chair. Thank you, Chair. Bye.
Yeah, can you hear me?
I can hear you, sir,
Can
but
yeah.
I don't know whether it's my network or
Yeah.
your network.
Okay. Honourable members, I just need to check whether I've switched off my camera, whether you can hear me now. I must change and move around. Am I audible, Ms. Machalamba?
Yes, Chair. Yes, Chair.
Yeah. This may process by the would probably process.
We can't hear you now, Chair.
What's now, Chair?
We can't hear you now, Chair.
Okay. All right. Okay,
That's
I need to
better
move
now.
around
That's
and
better
find
now.
it.
Just stand there, Chair.
Yeah. This process, Honorable Judge, was provoked by the request of Dr. Letape. And members have since confirmed that what was read by Ms. Machalamba as the process of processing a bill be adhered to, because it's not just for us, it's the parliamentary process of all portfolio committees. And therefore, we now would go along with that. And you probably know if you have to change parliamentary rules or procedures, there's another process that can be followed. Yes, that can happen if you so desire, but for now, going forward, we will then stick to what is currently being handled, which is what we have just read. If I was not audible in the other part, I was confirming that Ms. Mhlongo, you do consult your political party continuously as you are processing this, because we are only sent by our parties to do what we are doing. So when you stand up there and say support or not support, it will be because there is a message that comes from your party to do this and that. One part which members said they didn't hear well, I was outlining to say we hope to be completed on these processes. That's why, please, Dr. Honorable Mutubasi, when you request a postponement, we are very thin on that. We really need to make sure all the people who want to speak to us get a chance by up to before end of August. Hence, I also, you heard about my discussion with the chief whip. I don't have to go back to that. Did you hear that one? If you heard that the chief whip has said they've spoken to the parties, chief whips, and they are saying in principle they might consider, let us send a request, however, to during our research act public hearings starting maybe around 3 o'clock in the afternoon, and we might really then be able to push and project to complete by end of August, which then might allow us to, if we apply now for a study tour for the first week of September, it would be a very opportune moment to do that. We have completed every other listening, including probably the suggestion of Honorable Clark getting SAPS and Treasury to listen to them about the illicit and what are their plans to do that, to improve that, so that if we then come back on the second week of September, we would then be ready to do clause by clause, having got all the knowledge that we have acquired from all other places, including this process that we are engaged in. Then second week of September, we do clause by clause and hopefully complete that process and be ready to deliver this bill to Parliament. I did raise that October is a very difficult month in Parliament. There are certain parliamentary prerequisites that you need to meet. Among others is BRRR and mini budget processes, which has to be done by every portfolio committee. and then the next month it's really wrapping up. So if really we adhere to these timelines that we are projecting and suggesting, we may just meet those deadlines and be ready to get the bill out of our hands as a portfolio committee towards the end of September, and then get it into Parliament, and then it's ready to go to the other house the following year. If we miss those deadlines, we may just be close to getting the bill back to us in 2026. So I was summarizing some of the things that maybe honorable members have said, and I hope then we are now covered on this process. Thanks. Honorable Motubatsi.
No, thanks very much. I think we are covered, and my apology, because when you opened, I had the challenge of network, but when I saw the presentation on legislative process, I had thought just to take other members into confidence on the letter that I had written to you on the regulations. I thought that that would be sneaked in. And just to implore you, if you can just brief members on what I was requesting, so that we must not waste time to come back to this particular issue. Maybe members would like to have a bite on the regulations that were presented by the department on the NHI. Thanks, Chair.
Okay. No, it's just that I think the referendum is now logged in, but I'll just raise that as we wrap to a close. Honorable Motubase wrote to me requesting processes of NHI regulations. Why they were not presented to us, then I had to go back and check the process. The department can actually at any given time, the bill is now an act out of our hands. It's in the public space, and therefore they are following their processes of publishing regulation to beef up the NHI Act. They may just give a notice to say we have published these regulations. Here is the copy, but there's no obligatory responsibility for the department to come to the portfolio committee and say we request to brief you on the regulations. As members of the public, we may meet them here and there also and comment if we so desire, but it is not a process that comes to Parliament or to the portfolio committee to deal with the regulations of an act. So I clarified that to Honorable Motubats, and he was, to me, satisfied that. But I said, out of courtesy, the department that are here, I've already checked on the podium with Dr. Anpan Pillay and Mr. Khalsa. It would be to ambush them to say, as we start this next item, they must now give a highlight but there is no obligation for us to have a portfolio committee meeting to listen to the Department of Health presenting regulations to us. Thank you very much. Okay. Then we can pass. Mr. Khatla, I see that you are logged in.
Before you pass, Chair.
Yes, sir.
I will make a request to the Chair that we put an item on the agenda of discussing the regulations amongst ourselves without the department, because they are out there for public comment, but some of us have certain concerns about duties that should be done by Parliament and the committee rather than by the department. So can we make space for the committee discussing that issue, putting it on an agenda, even if it's when we're having hearings and we just get given 30 minutes to air that before.
Okay.
Just a request.
I hope, Dr. Letape, I will hold you to that. It will be 30 minutes. I will hold you to a 30 minutes request, and probably not more, because I still have to consult with the head of programming in this committee, who's Ms. Machalamba, so that I really don't take her out completely of what she's planning that we do. That's fine. It's acceptable. It will then have to fit in within the space of what we are doing. Thank you much. Ms. Machalamba, I hope you are listening. We'll remind you when we're doing our site meeting as to how we can slot this strictly 30 minutes request by Dr. Letlape. I hope Dr. Letlape speak on behalf of all of us. It's not 30 minutes for him on the regulations. It's all of us combined. Okay. Honorable members, I see that the department has logged in. Oh, Honorable Clerk, let me do before that. Honorable Clerk, come also.
Chair, it doesn't stop any political party to actually submit their own submissions. I mean, we've done that in terms of the regulations to the Minister's office. So, you have that leeway to do that. Thank you.
Okay, all right, understood. Thank you for that addition. Honorable members, the Department of Health has logged in here in this meeting. I've spoken to the leadership of the department. Okay, firstly, the minister is out of the country. The deputy minister is also out of the country in different countries. I see there's acting DDG here because the DG is also out of the country. I've since spoken to the House Chair. The House Chair then asked me, Dr. Lomo, what is the meaning of this meeting in the light that the department has written to me, and also I have noted that there are no changes on the budget. Of course, it's just that there's been too many budget speeches, but from the previous budget speech and this one, which is a requirement for us to meet, there's not been any change on the budget into provinces from the Department of Health. So what would be presented to us is what was presented to us a month ago. And on the basis of that, to respect the chair and saving his time and saving the parliamentary time, I am therefore indicating to Parliament that I have consulted the department to say there are no changes that are there between what is presented now than what was presented then on the budget, because this is what we are listening to, and therefore calls for us not to really continue with this meeting as we had planned. But before that, I want to check if that is the understanding that the department has had on this matter. We're already on the new item now. Mr. Khatla and Acting DDG, Professor Nicholas Christ.
Good morning, Chair, Honourable Chair. Good morning, honourable members and colleagues who are on the call. So thank you very much for that introduction and for inviting us. Indeed, there's no change to the budget and the previous presentation. However, there was an indication in the third tabling of the budget of an additional amount of just over 20 billion that will be allocated to the department in the coming 3 years. And on the basis of that, we have not received the allocations yet, but on the basis of that provision, there is an indicative 6.7 billion that will be allocated in this financial year. So if there's anything to present and discuss to the committee, it would only be on that 6.7 billion and the promise of a slightly more, it's 3.1% growth over each of the coming 2 years. So, Chair, I'm not sure if you wanted us to still present just that 6.7 billion and what we know about it. It's not, we don't have the allocation letters yet, but we know that that has been provisionally allocated for the health function. Thanks, Chair.
It was on the basis of that, honourable members, that the advice to this portfolio committee by the House Chair is that there's really no material need for this meeting to consider that 6.3 billion promise still to come, and therefore requested to save Parliament's budget and time and your time by not necessarily engaging on a meeting that has nothing new to table to us. And therefore would want to request honorable members that we do adjourn this meeting, but we then use the time to accept that which or reject it and the presentation. When we do that as a portfolio committee based on their presentation that came to us and was debated by us and listened to, we may just add that we hope that that promise of 6.7 1 billion will then come some other time. So requesting members to consider that we do not continue with the meeting. Let me hear if any member feels that there's a contrary view. And then on that, honorable members. Okay, Honorable Clerk.
Thank you, Chairperson. Yes, I do agree. We've already gone through the budget report last month, and if it's the same, then it's the same. But it would be interesting just to know what the 6.7 billion rand that's going to be allocated to. That's the only change. If Prof. Crisp can just give us background to that. Thank you.
Honorable Topale Tlabe.
Thank you, Chair. I just concur with Ms. Clark that can we be briefed about the aspect that is relatively new, the 6.7, so that we can engage with that. I agree that the others have been presented, and I have no problem with that.
Okay. Professor Nicholas Crisp, just explain to us the promise and the timelines when the promise will be realizable. But before that, okay, there's Honorable Teko. Honorable Teko, before Professor comes in.
Yes, Chair, it was my indication that I also agree with the proposal, not to continue, but we can hear what you are suggesting. Thank you, Chair.
Thank you. Professor Nicholas Crisp, just be crisp on your presentation about this crisp budget of 6 billion. When do you expect it? How it will be allocated to you? What areas will it cover? Thank you very much. Over to you now, Professor.
Okay, thanks very much, Chair. So what we have been doing during the course of from November onwards is between the provinces and the National Department, we've been identifying priorities. And 4 priorities were identified. One is to any additional money we should use to employ doctors, nurses, and other healthcare professionals who are out of jobs so that we can open up some more posts. The second priority is to make sure that all the community health workers who are currently on contracts and have been for years, and there's been a court ruling, that all of those should be employed into permanent positions in the department at the starting notch. That was the second priority we discussed. The third priority we discussed is to, there was a long list of beds, mattresses, linen, and other ward items that were identified as being in shortages in hospitals around the country. And that was quantified as about 1.4 million items at a value of about 1.3 billion. So that was the third priority that we identified. And the fourth priority is that there are accruals in most provinces. In fact, all provinces have some accruals, and that we have been reporting on what we call key accounts, which are things like the National Health Laboratory Services, blood services, medical equipment purchases, and so forth. Oxygen's another one of them. And that we should put, if we get any more money, we should make sure that we pay off some of those accrued amounts that are making it difficult for the hospitals to provide services. So that planning has been going on, and every time we get an indicative number, we re-look at those 4 priorities. So where we are at the moment is that we have been told that there will be 6.7 billion coming this year. We were initially told that we would see it as part of the adjustment appropriation, so in September, October, and that would have resulted in us only being given those allocations sometime around December or January. And obviously that would mean that we pretty much couldn't use the money for much because we would not be able to employ all of these people we want to employ. So the minister engaged with the Minister of Finance and was given an indication and told us that Treasury did have a way that we would be able to access whatever the funds are going to be before the final adjustment appropriation, and there's a mechanism that Treasury would guide us on. What in engagements with Treasury, what we have understood is that in-year budget adjustments, they first do using the per-cell costs and headcount, so the cost of employment. So they would make sure that all current commitments on COE are met first out of that 6.7. So some of it is not likely to be available for our new priorities. We don't know how much that is at this stage. What they will then do is allocate the remaining portion to the provincial equitable shares as a top-up to the provincial equitable shares, and they will give us those allocations in due course. We have, on the basis of that, developed a model so that we can still give an indicative allocation to each of the provinces once we know that amount, based on the 4 priorities that I outlined a moment ago. So in summary, Chair, we don't know exactly how much we will get. We don't know when we will get it yet, but it looks like we will get it early enough in the year to begin the appointments of some people. And the provinces are all on board with those 4 priorities as to where we would direct the money. Lastly is that if we incur expenses on conditions of employment, obviously we need that to carry through. So we have done carry through estimates of the recurring costs, particularly the COE recurring costs over the coming 2 years. And based on our modeling, it looks like we can employ people, and we will be able to pay off the bulk of the present accruals, in fact, nearly all of the present accruals over the 3-year period. So a lot of planning has gone in, Chair, and as soon as we know exactly what we are getting, it will obviously be in the public domain. Thank you.
Honorable members, let me add, having heard this from the minister himself, that these are the pressure points that they would like to work into employing doctors, nurses, and other healthcare workers, looking into the full employment of community healthcare workers, supporting those missing nurses and beds, and then deal with the accruals. I then said, Minister, I'm glad you are engaging the Minister of Finance on this matter to facilitate and fast-track that process. But once that allocation comes to your space, I would like to hold you responsible for this money not disappearing into the equitable share of provinces, and find that the money is probably allocated to go and build a swimming pool or do these other things other than these 4. So how do you make sure, Minister, that this is going to be ring-fenced for that and not just get swallowed by the equitable share? And I actually would get the minister's plan on this, which probably is what making me comfortable to say, as Professor Nicholas Cripps is saying, all provinces know what are their priorities, but the minister and the office of the minister and the national department, Professor Cripps, will still have to go to say, if this money was to employ that doctor in Potchefstroom and that doctor in Anduli, so be it. It can't go and do something else, so that you can really relieve this pressure that all, including the minister, are on this platform. So I hope that you will continue to that promise of not getting money disappearing into the equitable share of provinces, and suddenly it does not do what it was meant to when it is ring-fenced to be doing these 4 pressure points. And if it means national is to go there, because sometimes, honorable members, we have been in government sometimes, premiers will decide that the pressure is on the floods. Let us take this money that came into this port and send it to this place. Yes, floods has to be supported, but let's motivate for that additional money for floods or other things, rather than to take what has been ring-fenced here to support these programs to come up. So I would only allow members to really speak on that part if they are, but that is the issue that we are thanking the department. And please follow this up and see that this is how it will be done, Professor Cripps. Thank you very much. All members, if you want to come in, let me recognize the hands. Honorable, in this order, Honorable Dr. Leroux, Honorable Mutubatsi, third, Honorable Van Staden, fourth, Honorable Dr. Letlhapwe, in that order. Dr. Leroux, Mutubatsi, Van Staden, Letlhapwe. Any other hand or anyone who wants to shout? And Honorable Mjatu, number 5.
Thank you very much, Chair.
Yes,
thank you to Professor Cripps for that feedback. It's very hopeful to hear that this money is probably going to be made available. And I just wanted to ask two questions around the funding that's been made available. And I appreciate you giving us a breakdown of the priority areas. I think the one is around the community health workers and the absorption of community health workers into the system. That's obviously potentially a burden on the health system going forwards. I know it's legally mandated by the court case, but could I get a sense of how many community health workers we are looking to absorb with the money, and what approximately the funding, the costs would be of absorbing those community health workers? And also just to get an understanding what the current roles and the current supervisory structures are of those community health workers, because I think that's very important, that if we are employing people, that we need to make sure that they are doing the work that we are asking them to perform. So I just wanted to get a sense of the community health workers. The second question was just around the PEPFAR funding shortfalls that we've had, and whether any of the money that is being made available of that sort of 6 billion per year or 20 billion over 3 years, is any of that going to be allocated to PEPFAR funding? And I understand that some of that will be, if we employ nurses and doctors, we might be able to cover some of the areas, but is it specifically being allocated to that? Thank you very much.
Well, thanks very much, Chair. Chair, I want to implore the department that and plead with them that whenever such matters are brought, they must be specific, following on what Dr. Tlapef said, and also following on what you have just said. You know, they create what I normally refer to as a tantalizing mirage when they come to to present to the committee. We just want specifics to say, we know this is what is going to come. For the community health workers, this is what we are attaching to it. We take the fact that the money is not yet in their hands. But now, when they come to us to say, these are the line items, these are the priorities that we have, but then they don't attach what probably they are expecting in rents and cents, that we have a clear idea as to what is happening, then they are giving us a problem. Me in particular, I then have a problem. So I'm just requesting with the department that whenever they come, they must just be specific and say, this is what we are putting on this priority, even if it's not going to come, but this is what we are fighting for, so that we can get, so that in future we don't have this difficulty of saying money might have fell within the cracks. Your concerns are correct, and I think it's the concerns that Dr. Ruiz also raising, that let's just be specific, and that's what I want to request. If the department can do that, then I'll be happy. Thanks, Chair.
I think it's me now. Thank you, Chair. Now, this is a matter that we have been struggling for many years to get this funding for doctors and nurses and equipment and beds and all that stuff. It's good news to hear about the 4 priorities, and I also agree with my colleagues who spoke before me. Chairperson, I agree also with you that we must just monitor as a committee this situation. I agree with you, Chair, but the money doesn't go anywhere else but for these priorities, but we must monitor it. And I also would like to get some more detail, for instance, in the appointment of doctors and nurses with this money, if we can be informed how many, how will they be distributed across the provinces, etc., etc. If you understand what I mean. The same with the medical equipment, which hospitals will get attended to, and so forth and so forth. I know it's a tall order, but it's something we need to know. But therefore, Chair, no, thank you. We just need as a committee to monitor this then. Thank you.
Thank you, Chair. And just correct me if I'm wrong. Ring fencing is not legally enforceable, unless if it's not a conditional grant, then it will be spent on what it is meant for. Otherwise, you're still at the whims of the provinces, and if they don't do act according to ring fencing, there's nothing that you can do legally. So I would rather want to see this being given out as conditional grants, so that they are spent where they are meant to go by law. And if you don't, you can't spend them on anything else. If you don't do that, it's not going to work. So for me, Chair, would like that assurance. Because as happens out there, money gets given, frontline post gets frozen, even though they were funded posts in the initial allocations, the money disappears. Unless it's a conditional grant, nothing's going to happen. There's nothing that you can do to them. It's just their word. And if they don't keep their word, there's nothing that you can do. We can no longer operate on those bases. We want legally enforceable guarantees that if it's money for community health workers, that's the only place it can be spent on. We don't want this buddy, oh, I will do that. That's not legally enforceable, Chair. And that's why the healthcare system is where it is today.
Okay.
Thank you, Chair.
After Honorable Mchatu, there will be Honorable Kumalo. Thanks.
Thank you very much, Honorable Chair. My questions, Honorable Chair, it's I'm having a concern here, Chair. I just want to find out to the department, do you aware about those chief directors in KZN that was suspended a long time ago? But do you know how much money are they getting while they are not working? But nothing happened to them. They just getting paid, sitting at home doing nothing. But I think your department must come to these provinces and check, because there's a lot of corruption happening in these provinces. Can you imagine directors sitting at home for more than 2 to 3 years doing nothing but getting paid for the department? Can you clarify for me, what are you doing about those shift directors in KZN, chowing money for the government, doing nothing, sitting at home, no cases, nothing, but they're getting paid every month? We support your budget that you want to employ more doctors and nurses, but I'm having a problem when it comes to corruption, especially in provinces. How are you going to make sure that these MECs in provinces, they are not employ his friends and family and comrades? I thought I will ask this question direct to the minister, but because we are here, we can answer this question for me if you can. Because I'm worried about these directors. They are getting money for the state, doing nothing, sitting at home. I thank you, Honorable Chair.
Okay, Honorable Kumalo.
Thank you very much, Chairperson. Thank you for the presentation from the department. And I want also, Chair, to thank the department for these 4 priorities that they've outlined in this meeting. We really appreciate, Chairperson. The issue of CHWs have been a thorn into our regions, into our provinces, and we really appreciate. And the issue of employing doctors, all of us, we know that it was an issue in our committee in Parliament for the long time. At least now we're having a breakthrough. We really appreciate that we are really the government that is listening to what other people are saying. Chairperson, I want just to make a recommendation that when this money is transferred to provinces, let the committee get reports, and we also have the mechanism that how the department nationally is going to monitor the implementation of these 4 important what have you said? These four important mechanisms to try to address the issues of health in our different provinces. Let us have the mechanism to make sure that we do oversight and we make sure Goguti, the plan that provinces have submitted, it is adhered to. Thank you, Chair.
Professor Crisp, you have heard what members are saying. They are actually raising some of the things that I have also opened up with in my remarks. Safe to say, the issue of Honorable Mjatu, maybe you may comment, but you may not have answers to it completely here, and then may follow up some other time, but you can still comment on it if you do have information. You see, when I discussed this matter to with the minister, I said, Minister, I hear this, but from now onwards, can this be an administrative process? Getting this and getting it from Treasury to the department nationally and to the provinces. And to such an extent, Professor Chris, some of us think that the people must be closer to this process at the heads of departments, more than some of the political leadership that might. So that is how far I expressed it to the minister. Any head of department might not be able to stand the political direction that says the money must go from here and move somewhere else. But if we then have to really, so I was assured, and I hope we are enforcing it here through other members to say this process must be administratively clean, such that what it is due for, it is actually what is going to be done. And this portfolio committee here, members are strongly saying, let it be so. Because these pressure points that we want to actually work on are very critical, absolutely critical. The issue of community healthcare workers has been more than a decade now. And so I hope that you will do everything administratively possible, that the allocation will just be as members are saying. But do comment on what members have raised. Professor Crisp.
Thanks very much, Chair, and thanks, honourable members, for the questions. We share a lot of your concerns, but let me try and explain exactly where we are with this. So firstly, on the question of community health workers, this has been a long, drawn-out process, and we have had interactions with various unions, with Treasury and with others, and with all the heads of departments. There are presently just on 45,000 community health workers in the system that have been on these roving or rotating contracts for years. 27,109 of them have matric, and the remaining 17,900 and something do not have matric. So we have to deal with them slightly differently when employing them into the public service, because the requirement for employment into these positions is matric. So what we have done is there is currently a grant. It's a conditional grant. It's a direct conditional grant that is allocated to the provinces for what has been contract employments of community health workers up to now. The difference in the amount they are paid in those contracts, and for us to employ people, but to take those with matric and put them onto the starting salary notch in the public service, which is level 2, notch 1, and to take the remaining community health workers who don't have a matric, but to increase the stipend they get in, because we can't employ them into permanent positions in the public service. The additional cost for all of that will be 1.4 billion. So it's about another quarter on top of what we are presently spending in the grant. So that is an additional carry-through cost that will be required into the future. Now, together with that, what provinces have been doing is employing community health workers, those who have been community health workers up to now, into other vacancies in their departments, sometimes porters, cleaners, clerks, depending on their skills and their capabilities. So a number have been employed into those positions. But we have been at this collectively for a very long time now, and we have a very clear handle on the numbers per province, both in terms of numbers of people and the numbers of the cost that will be involved and the carry through. I do want to say that I think the Honourable Leroux asked about supervisory structures. All of these community health workers are part of ward-based outreach teams, and they all have supervisory structures. They're usually staff nurses who are the leads of these teams, but there's no place where we employ currently on contract any community health worker without them being part of a team. So they will just be coming into the public service in the same structures that they are currently supervised in. The second part of that question, or from Dr. Leroux, was about PEPFAR. No, none of this money is allocated for any of what we lost during PEPFAR. That's a separate process. And just so that that's also understood, we have had many engagements with the various role players, including National Treasury, and we have submitted a written request for emergency funding, well, we call it emergency funding, but funding that's outside of the budget process. And we have not received a written reply yet, but we do get questions back about what it is we put into that request. It is a request for service strengthening at patient-facing level. It's for some technical assistance that we lost in the systems management and data management. And then there is a separate request for to meet some of the shortfall in the research projects, because we've lost billions in research funding in this process. So when we get responses on that, that will be money that is outside of the budget process and is dealt with completely differently by the National Treasury and the Minister of Finance. So this 6.7 billion does not include whatever we need for PEPFAR. But as you rightly said, obviously, if we do employ more doctors and nurses, they pick up the slack, and what was previously vertical programs are being integrated now into the horizontal primary healthcare system, and everybody will benefit once this shake-up all settles down. Regarding the Honourable Matabatse's concerns about what he could refer to as a tantalizing mirage. We couldn't agree more with you, Honourable Matabatse, because we also find it as a tantalizing mirage. Treasury will make an announcement, the Minister will give a big number, and we won't get the details for months and months until it is finally on paper with allocations. So I'm afraid it's the reality of the situation at the moment, and I guess a little bit more acutely felt by us because of the pressures in the budgets, not just this budget at the moment, but the budgets we will see going forward. So what we are fighting for at the moment, what we are hoping for at a high level is as follows. We want to see a minimum of 800, but we are hoping 1,200 doctors. We want a minimum of 200 nurses and 250 other healthcare professionals. And we've identified where they need to be across all the provinces with numbers. But obviously, until we know how much money we've got, we can't be more specific than that. We want to get those community health workers I referred to into the system. In other words, the 27,000 fully employed and the other nearly 18,000 at least on a better stipend than they are getting now. That's the target. In terms of the hospital beds and linen and mattresses, the process that was followed was that we called a survey from every single facility. It came through to National when we sent it back to the provincial heads of departments to confirm what their hospitals were telling us. And through a backwards and forwards iterative process, the heads of departments signed off on the quantities. So we know, for instance, that the provinces have collectively indicated there's a range of different kinds of beds that they want, and those are sometimes ICU beds, sometimes ordinary hospital ward beds, but there are about 25,000 across the country, and we know per province where the shortfalls are. And then there are the various mattresses and so on. In terms of the bed sheets, pillows, pillowcases, blankets, towels, and so forth, we know that there are 1.25 million items that the provinces have requested across their facilities, and we know which facilities they have quantified them in. So what we have done with the Minister has been in discussion with the Minister of Social Development, And we have motivated to National Treasury that at least for the soft items, the bed sheets, pillows, and the rest of the linen items, that we would like those to be in a conditional grant, an indirect conditional grant, so that the National Department can procure them through the factories that are run by the Social Development Department for people with disabilities. They're called the SEE program. We have submitted that request to the National Treasury because they had not agreed to allow the full amount to come into a conditional grant, just as they've not agreed that anything that we get for in lieu of the PEPFAR shortfall would come into a national grant. They are adamant that these things go into the provincial equitable shares. So that's the third target. The fourth one, on the accruals in the health sector, we know exactly where the accruals are by province. We know what is owed to AFROX, to the members of the Medical Devices Association, to the National Health Laboratory Service, National Blood Service, and some unpaid medicines. We know per province, per hospital, what is in accrual. And we have worked out with them which of these can be paid off or should be paid off immediately. And if we are only able to employ people in the second half of the year, then there will be more of the 6.7 million in the first year to pay off on accruals. Whereas if we, and then of course next year there'll be the carry-through costs of a full year on the employment, but we will not have the beds, linen, and mattresses to purchase in the second year. So the money that is a once-off for this year will be added to the available funds for the accruals. So I'm sure I'm giving a long explanation. I'm trying to explain without providing the exact figures, because we don't have exact figures from Treasury yet. Just that the heads of the departments in the provinces, through the National Health Technical Council Technical Committee and our department, have been busy with these numbers for some time now, and we have it in great detail. So Honourable van Staden asked how we're going to monitor this, and this has obviously been part of our discussions as well. We share the concerns that have been raised in this portfolio committee. So the intention is that once we have the actual figures allocated to a province, to each of the provinces, we will very quickly be able to generate the numbers as the, let's call it the fair share of the total expectation of what we're trying to achieve. And the DG will enter into an agreement with each of the provinces that these are the targets we are going to monitor. Straightforward for them in each provincial Department of Health to tell us, well, we bought this number of beds and we employed this number of doctors and so forth. We are under no illusions that we need to be very sharp and closely, especially because it's not a conditional grant and it's going to be in the provincial equitable share. The Honourable Letlapi is right. One of the challenges is that if the money goes to the provincial equitable share, the National Department of Health has no say over that money at all. In fact, we just hope it ends up even in the health sector and doesn't go to other functions of the province. But those are things that have to be reported in the provincial legislatures, and you, honourable members in the national government, will call on us anyway to report on these things. So while we share your concerns, we will obviously do our best to make sure that all of these funds go to what we have collectively decided they should go to. So, Honourable Mdadu, I won't go into specifics except to say that in the public service, there are very specific administrative procedures that need to be followed. And the National Department is not mandated to interfere with any department in a province. We do offer support, we do monitor, we do cajole and work together with our colleagues in the provinces. But the provincial government, and specifically the departments in the provinces, are responsible for monitoring what goes on. But if you provide us with the names and details of people that are still suspended and where the cases have not been finalized, we can certainly find out what the holdup is and see whether there's something we can do from national to support the provinces to deal with that. So to Honourable Kumala, I just want to say thank you very much for acknowledging we've worked very hard at trying to do this in a very targeted and balanced way. But until we actually have the allocations, we can't hold anybody accountable for anything yet. And we fully expect that you will hold us accountable once we do have those figures. So, Honourable Chair, I think that's I've responded on behalf of the department for you.
Okay. Honourable members, we have really had a very elaborate response to some of the things, thanks to the generous contribution of Professor Nicholas Cripps. And then I think we are covered. We'll monitor this process. You can hear, Professor, how members are very much concerned about this part. And this is one area where you just have to pop out. We will not know as soon as things are starting to move with these 4 pressure points and you are attending to them. Just give us a shout and you then indicate your readiness to indulge us and inform us that things have gone well the way you had planned it. And that would be a great achievement for yourself and for all of us. With that, honorable members, I see another. Is it a new hand, Honorable Mutubase?
Yes, Chair, it's a new hand.
Yes. On what point?
Okay. No, thanks, Chair. I am concerned with the trajectory that the department wants to take on the community health workers. Just to get clarity on the court decision, did the court say that there must be a segregation between those that do not have matric and those that have matric? Because the 18,000 that we're talking, if I was still in the union, I would actually take issue with the department on what the department would want to do. And I think the department needs to protect itself so that we must not be held, the department must not be held to court on this particular matter. Because there are ways in which the 18,000 can be taken into the system because they've acquired skills over a period of time, some of them for more than 10 years. Now, when they are supposed to benefit from the work that they've been doing, now the department comes back and want to water down and ignore the skill that they've acquired. If I were in the department, I would collaborate with the health and welfare sector to make sure that those workers are upskilled, they are actually taken into the system based on the skills that they've acquired, get them into a learnership that is equal to what the matric people, because that matric separation to me is irrational based on the skills that they've and I want to implore on the department not to go that route because it is illegal in terms of the skills that they've acquired. They need to be taken into consideration and manage this process accordingly. That's my issue, and I have a serious issue with what the department want to do with regard to this matter.
Okay, Honorable Shabangu, please switch off. Thank you very much. Honorable Mutubase. Honorable Shabangu, we can hear the background noise behind you. Honorable Mutubase, let us actually be comforted by the process that the Department of Health now has since started to court processes, operationalizing what has been a long outstanding process. If we have add-on suggestions, let's do so. But let us also agree that community healthcare workers is not a homogeneous group of South Africans. There are different levels of ages and different levels of educational background. And they have all been prioritized to be assisted with various methods. Let us actually accept that we might add on certain suggestions, but the bottom line is the Department of Health has also not necessarily, I wouldn't say willingly, of course, there were always those desires, but the court has now said, do something about this process. And they are operationalizing what is to be operationalized within the constraints of the budget. There's 50,000 community healthcare workers. They are starting step by step. So I think let us agree and accept that the process is on, and it may not be completely perfect in the first financial year, but there is a process to actually work on this, and we would really be getting continuous updates on the process. Some of our wishes may not all of them be realized first month, but let us actually agree that they know better in terms of the profile of each and every community worker, and they are actually assisting them based on their level of skill. Yes, some of them can be skilled to whatever, but let's just work on that and let's wait for their operationalization of this process, and here and there get them to update us, and we then can send some of our suggestions as we are doing to them. Honorable Mutubase, thanks. Honorable members, that was what we were to consider today. And thanks to the department for being flexible and agree to adjust. And thanks for pointing out what was to be done. Mr. Paswa, are you in the platform?
Yes, Chair.
CFO. Yeah, you must buy us lunch for not giving you a hard time on this meeting. Okay, we'll hold you on to that. Honorable members, may I request that we adjourn this meeting, and we will meet tomorrow at 2. Is it 2:30, Ms. Machalamba?
We are meeting at 5, Chair. We still need to adopt minutes.
Oh yes, honorable members. Tomorrow there is a members training. We were requested by House Chair that if we do have portfolio committee meetings, let us start at 5, because that process goes up to 4:30. It's a virtual platform of training members and retraining and getting that. So we're starting at 5 tomorrow afternoon. Have a good day. Thank you very much, members.
Chairperson, before you go,
Yes.
I've got my hand up.
Yes, I can see, Honorable.
Chairperson, there's just one matter I would like to raise with the committee. I think it's necessary that we start thinking about a process, how we are going to investigate ghost employees within the health department. And it's something that National Treasury has picked up throughout government. And I think we as the health committee also need to take some kind of responsibility in order to think how we're going to have this matter investigated. If I'm just putting it on the table. Thank you.
Okay, if we're in the full house, we're going to say in the next meeting I will raise the following. Okay, noted, and we probably may touch base. Please do share with the chair and with the secretary some of the issues we need to. If it is a matter that is of concern, yes, let us. We might spend little time and some time on it in the near future. Thank you very much, Honorable Clerk. We'll note that. Can we then adjourn this meeting, all members? Thank you very much.
We still need to adopt minutes, Chair.
Oh, you asked for the minutes adoption. Can I release the department then? Department of Health, you are then released from this meeting. I didn't check. I read 2 sets. How many sets do you have, Ms. Machalamba?
4.
Thank you. Colleagues, we can leave. Bye.
Bye. Thank you. Honorable members, this is to indicate it's not like, thanks, we started this morning by reading the process of how to deal with this bill. But what we are going to get now are the minutes that this meeting did take place, and we did receive a presentation from so-and-so, and check your availability on that day, and that's it. That is the main purpose of what we are going to play. It's not necessary to debate whether what did I say, why is it not covered there in the report. It's to say the report, there's a presentation that was made by this entity, we listened to it, and we commented on it, and then check your attendance. Okay, you can start then flighting those minutes, Ms. Machalamba.
Can you see them, Chair? The minutes of the 28th of May.
I don't see the date. I can see our names. What date was this?
28th of May.
Yes. Honorable members, on the 28th of May this year, we had a meeting virtual, were the adoption, and okay, these are the members who were present. What was the heading here, Ms. Machalamba? Just go up a bit. What were we doing on this day? We were on the public hearings, and then we adopted certain meetings. Okay, look up, go up and check what public hearings we had. That, honorable members, this is the reflection of your presence. Do indicate if your name is not there and you were there. And the public hearings was involving the two agricultural related bodies. It was Agriculture South Africa, Agri-SA, and Agricultural Business Chamber. Then they presented, and then we listened to their concerns, and their presentation is part of that. You probably have read all these presentations, honorable members, the two that were on this day. Can you go towards the resolution or recommendation? Agree to say, in conclusion, it was suggested that the committee that the committee should set much. I can't read this thing. Should hold
debriefing sessions
after every. Okay, so this was the suggestion that we have just dealt with. The chairperson further announced that the committee will invite NEDLAC to appear before it to address outstanding questions that were not responded to. That first part, Dr. Leroux, was in response to what was raised by Dr. Letlapa, which we have dealt with when we started this meeting. And this outstanding meeting with NEDLAC is still to be sorted out. We would like, therefore, to request members if we can move the adoption of these minutes of the 28th of May, 2025. Any mover? By shouting or show of hand?
I go move, Chair. Malo second.
Honorable moved and Honorable Sin second.
Thank you.
Thank you. Let's move to the second. Thank you. Second set, Ms. Machalamba. Come through, Ms. Machalamba. Ms. Machalamba, you are not successfully bringing the second set of minutes.
let me try again, Chair. Sorry about that.
Okay.
What is happening here? What is this thing doing this? 28th May. Okay. Window is closed, right? I'll try again, Chair. I'm having challenges with my gadget. I don't know what is happening with it.
Okay. Yes, Ms. Machalamba.
I can't share anymore. I'm not sure what is happening with my laptop, Chair.
Who else has got a set of minutes and co-hosting rights?
Mbali and Zube, I'll ask Zube.
Right. Assist us, Zube.
Buyu, can you just give me co-hosting rights, please?
Honorable members, on the we met also considering the public hearings and just to check your presence there and those who had apologized. And on that day, go up to pay. We were listening to move up so that we can see who was presenting to us. On the 3rd of June, we were listening to the presentation from Consumer Goods Council of South Africa. And there's another presentation, and then that presentation was received. And the second presentation was from...
We only had one presentation in the morning, Chair, and we had two in the afternoon after plenary.
Or only this one presentation where we concluded that the Consumer Council reaffirmed its support to tobacco harm reduction and public health, but insisted on the context sensitivity enforcement. So this is what we are recording, what actually they presented to us. Honorable members, if we do accept that on the 3rd of June, we did listen to the Consumer Council, can I get a show of hands to adopt these minutes for Honorable Sine?
Thank you, Chair.
For?
Yes, I'm calling for the adoption of the minutes.
Minutes calls for adoption. Any seconder? Honorable Mutubatsi.
Yes, Chair, second.
Honorable Mutubatsi, second. Thank you very much. Can we move to the third set of minutes, Mr. Rahim?
This was the second meeting on the 3rd after the plenary.
Oh yeah, we met twice on this day. We came back in the afternoon, and these are the members, all of us, which was a full house, and we had, I think, 3 presentations on this afternoon. The presentation had was yes, Sun International, Sun Revolution Vape. These presentations were made to us, and we engaged, and then let's see what we did conclude. In the conclusion, all of them are talking about issues related to the hospitality and how the bill has an impact on the hospitality industry. The committee to reconsider plain packaging display bans, ministerial overreach. This is Mr. Visache further highlighted that a separate bill would be good for the vaping industry. So this is what, and here we are recording mainly what the presenters had made to us and then still to be discussed further by us. May I get an indication if honorable members would agree that these are the 3 presentations that came to us and they were presented to us for adoption? Okay, just check. Honorable Mutubatse? Okay, hand has disappeared. Any?
Yes, Chair, Treko moves. Treko moves, Chair.
Treko moves, and Mutubase hand came up and gone. Thanks. Mutubase, are you seconding?
Chair.
It was a full house, yes. You were there. Honorable Mutubase seconding. Thank you very much. Is that the last, or there's another last set of minutes, Rahim? Ms.
The
Majalani?
last set is the 4th of June.
June. The next
Yes.
day we met again. Like those ones, right? On the 4th of June, we were working hard. We met again. Members, check it was a full house again. And the time, 4th of June, we had the presentations from Smoky Treats and European Rolling Paper Association. Very interesting presentations we had, engaged with them. They expanded on what they would wish to see happening. Even the people who are out of our borders of our country, Europe. This Michelle informed the committee that the majority of European association members do not belong to tobacco industry, and therefore they should not be regulated as such. Also, that was just what was picked up by the person who wrote the minutes, but for us, it's just to acknowledge that we did engage with these two institutions on the 4th of June, and I would therefore would like to get members to approve our availability to be in this meeting. Calling for members to say yes. Anyone can shout even if you don't raise your hand.
I'm
Okay,
calling for the adoption, Chair.
Honorable
Sin-
Senekos for adoption, and we need a seconder. Okay, I'm going to. Honorable Kweko calls for the seconding Sineza calling for adoption. Let us therefore thank the team that has prepared minutes for us, and therefore all 4 sets of minutes have been duly adopted and seconded, and the meeting is therefore adjourned. Thank you very much. Bye-bye.
Thank you. Bye,
Okay.
all.
Bye.
Thank you, Chair.
Bye,
Bye.
sir.
Bye-bye.
Thank you.
Bye.